So we have it on hand. Welcome, everyone. Thanks so much for joining this afternoon, whenever you are. My name is William Schwerin, Director of Graduate Recruitment here at the USC Viterbi School of Engineering. Really excited that you took some time out, and thank you for joining today to learn more about our Master of Science program in Health Systems Management Engineering. Really happy to be joined by Professor David Belson also as well. He's the director of this program, and Dr. Belson will discuss the program in depth shortly. I just have some intro slides to go through, and then we'll also be joined today by a current student, which will be nice to hear from her perspective. I do want to encourage, if you do have questions, please bring them on. We do have a Q&A option on the Zoom. So if you have a question, please feel free to ask in the Q&A, and we'll do our best to respond to it. So without further ado, I'm going to go ahead and get started. And let me click here through my slide. So welcome to Southern California. This is the University of Southern California. We're a private institution located in Los Angeles. We were founded back in 1880. At the university, we have 21 academic schools and division. The Viterbi School of Engineering, one of those. It actually is one of the largest schools at the university. The university currently has around 44,000 total students. And one unique thing that I actually didn't realize prior to working here is that at USC, we have more graduate students than undergrads. So students pursuing their master's or PhD compared to undergrad. So that's kind of unique. And within the engineering school, it's very similar, where we have more graduate students than undergrads. So, I like to tell students who are looking at an advanced degree, a master's or PhD, that you can walk around campus and there's actually like a 50% chance the person across from you on the quad is a graduate student. You don't often see that at universities. Our location is in Los Angeles. We are back on campus, which is great. And Los Angeles, if you're not familiar, is a big city, big metropolitan city, a really fun place for a young person to study and potentially work afterwards. Our location is great in terms of temperature. I'd say in terms of proximity to a number of industries and other big cities as well. And within Los Angeles, more engineering graduates are higher than out of any other city in the US, which is pretty awesome. Going to discuss our engineering school briefly before handing it over to Dr. Belson. I do apologize for the wonkiness of this slide. It definitely is not something, it's not displaying how it was supposed to, so please bear with me, but I'll go through it. You see, as I mentioned, we have 6,200 graduate students. So those are students, combined master's and PhD students, along with 27 undergraduate students. Within the engineering school, we have 8 academic schools, or eight academic departments, pardon me. The department that our Health Systems Management Engineering program is based in is our Industrial and Systems Engineering department, okay? We have over 70 master's programs, 13 PhD programs. US News for our graduate schools in engineering consistently ranks us in and out of the top 10. Currently, we're ranked 12th, I believe. So we kind of bounce in and out of the top 10 between 8 and I'd say 12, 13 every year. It just kind of varies. So we're right there in terms of graduate schools for engineering. We do have a very highly ranked online program, and I'll touch briefly upon that a little bit later. So now I'm going to turn it over to Dr. Belson, our featured guest today, to discuss more about why you're here, the Master of Science in Health Systems Management Engineering.
Okay, thanks, Bill. It's good to be a featured guest. I appreciate that. So I'd like to talk to you about a new program we have, this Master of Science in Health Systems Management Engineering. Briefly about me, I've worked in several industries prior to joining USC about 20 years ago, and I focused entirely on healthcare. So I've got to know a lot about the healthcare business, the healthcare industry, healthcare work. And so this particular degree, it's not a clinical degree. We're not teaching people to do medical work. We're teaching people about how healthcare works, how the hospital works, how the clinic works, how the healthcare system works. And so we're providing the necessary background to work in the industry, not as a physician, but as a manager, as a consultant, as a designer, a number of different kinds of jobs. Healthcare is the biggest employer in the United States. Healthcare is the biggest employer worldwide. It's in every city and town. And so we have this new degree, and it's got some unique aspects I don't think are replicated anywhere. The degree, I'm in the engineering school, but the courses and the program is from 3 different schools. We have a leading medical school, the Keck Medical School, and the Price School, which also does healthcare courses, policy courses. So the program comes from 3 different schools. And one of the reasons we started this program now is healthcare has got a lot of problems. As you may know, the pandemic certainly got everybody's attention on healthcare. It's affected everybody. It's become a priority issue. And so the program is helping make healthcare work better, and it needs to, as the slide says, it needs to work better. The costs are ridiculously high. You may not need to buy much healthcare, but the people who require healthcare find it's terribly expensive. It's often not very efficient, and so that's what we're focusing on in this program. And in order to do that, we need to be aware and know and how to use new ideas, new methods. You may have experienced telemedicine. It's come to the fore. Well, we're getting a background in that with this program. Supply chains, a big challenge, having the right stuff at the right time, all sorts of shortages of supplies as well as people. Healthcare is a big user of analytics, if that's an area of interest to you. We have courses in analytics and projects in analytics using the digital data that's in healthcare. So healthcare is a changing thing, and it's not easy to change something so big as healthcare. So you want to go on to the next slide. So we have courses in the program on a variety of different things, as listed here, on how to make healthcare work better, and how to improve quality, how to manage a project, how to lead change. It's one thing to figure out how things should work better. It's still another to make it really happen. And I think a really key part of this program is we have the students doing real projects at real hospitals. Most are in Los Angeles, but we have, for instance, this semester project that the students in my class are doing up in San Francisco. So they're working on real projects, like this little diagram on the right. That was a dashboard, a report that the students designed for a cancer hospital, showing how it's performing. And so the students get knowledge in these various technical areas, as well as hands-on experience with leading people. We have guests and programs with people from the IT industry, which is important to healthcare, hospital management, technology, economics, and so on. So there's electives that one can take as part of the program to kind of customize it into what you're interested in, whether it's analytics or the business side or technical or leadership. So the courses are customized into whatever, particularly in this general topic, fits your interest. So we want to go to the next slide. So the graduates, when you do this, you're likely going to go work for a healthcare system, or it could be a consulting firm, or it could be a technology provider. I get calls certainly every week, if not every day, looking for people in this area. There's a real demand. A lot of times the employers are looking for somebody who with these skills so they can train other people at the hospitals. Even a smallish hospital, even a relatively small hospital employs a lot of people. And so graduates are needed to train other people. Oh, one thing I wanted to mention also early on is we're working in healthcare, and healthcare is there to help people. help people get healthy, help people prevent illness, to prevent things like the pandemic. And so much of the work and much of the education involves people. How do people work? How do they deal with patients? How do patients experience the healthcare system? And so it's a very people-oriented industry, and the training has to deal with that as well. In terms of applying for the degree, we're looking for people. It's a graduate program, so they need a bachelor's degree. It can be Bachelor of Science. It could be some other BA degrees also will qualify. It has a number of technical aspects to it, but largely any undergraduate degree with an interest in healthcare is sufficient. If you want to go to the next slide. As I said, the careers vary widely. People go into various kind of jobs. I guess I could explain a little bit more in terms of the coursework. We have the students doing projects. For example, this semester, I have a team of students doing work at a big hospital on how to schedule surgery. The hospital wants to do a better job in scheduling surgery. Another project is working in a cancer clinic, oncology, on how they can improve quality, how they can avoid making errors. The students aren't cancer physicians; they're students, but they can provide help in improving the quality. I've got another team of students working with a large hospital on the supply chain. Hospitals are really stressed these days on a supply chain, how to make that work, how to make a better use of their resources. So supply chains play a big role. One other project last semester we did, or 2 semesters ago, we students did a project with a mental health system. This was a national network of mental health clinics, and they wanted help in figuring out how they can expand. They had a lot of demand in the mental health area. They're very well funded. And so we worked on how to figure out what they could do, how they should go about it in expanding the mental health system. So there's just a wide variety of different kinds of things. Healthcare is a pretty complex business. It involves people waiting in line. It involves judging demand, forecasting, identifying and removing waste in the system. There's just all sorts of different aspects to the job. And so we try to do training so that the graduates can go into various positions. Some go on to medical school, some go into management, some go into their own startup businesses, and they pretty much keep in touch. If you want to keep going to the next slide. As Bill mentioned, we have a very, very large alumni network of alumni of USC. For example, Roop here, I've been in touch with him. He's graduated from this program. He's worked in consulting. He worked on startup businesses. So there's a lot of opportunity here. If you're an entrepreneur, that's great. Certainly can use healthcare. It's a big business. If you're interested in leadership and change, that's there too, consulting. So there's a variety of different directions you can go with this degree. And because we have not just an engineering side and a business side, we also have the medical school as part of the program as well. So some of the courses are given in the medical school. Anyway, this is kind of a quick overview. I hope I didn't ramble through it too quickly. I believe my email's there. If you have questions, I'm certainly available either in the Q&A or later if you want to email me.
Oh, wonderful. Thank you so much, Dr. Belson. So yeah, if you do have any questions, please do feel free to ask in the Q&A. Right now, I would like to have introduce our current health systems management, one of our current health systems management students, Christina Caratanuto. Hi, Christina, how are you doing today?
I'm good, how are you?
Great, thank you so much. Just have a few questions, maybe if you can talk about your background and your career goals for choosing this program.
Yeah, absolutely. So my background, I'm originally from Pennsylvania, from Philadelphia. I went to school at Temple University where I was a Division I student athlete, and I majored in health professions, which was very similar to pre-med. So with all that going on, I kind of wanted to have a gap year as I wanted to attend medical school. So after doing some research and just finding my likes and dislikes, I really was interested in learning about the healthcare system as I wanted to pursue it. And I think physicians need to know a lot about the healthcare system in order to be competent and do what they do best. So obviously looked at a bunch of different places and found USC. There were some amazing opportunities, and that being said, I saw this opportunity and I love engineering in general. So came out here to sunny California, love it out here, love the weather. Spoke with Dr. Belson, who has been an amazing resource. And I luckily have gotten to take class with him for my fall and now spring semester, which have been great. And so for my future, obviously I want to go to medical school. So I want to be a physician, and I'll be joining the United States Army for medical school as well. So I can serve. But the goal, like I said, is to go to medical school and hopefully be a physician. I love orthopedics, but backup plan, if that fails, I would love to go into obviously healthcare systems management engineering. And throughout the project that I've done the last 2 semesters, there's definitely a huge need for engineers, and the hospitals have showed a lot of interest with things that they do need. So that's been great again. And then also, I think furthermore, all the different, I think there's a lot of diversity in our program. So all of our students come from different backgrounds, and all of them kind of have different career plans. So just because you, let's say, don't want to be a physician, or you don't want to be a consultant or in healthcare, there's a lot of things you can do with this degree, and it's extremely helpful. And I think the whole program has just provided some great experiences thus far.
That's great. Thank you. Thank you for sharing that.
Yeah,
and letting me know
thanks,
that it's kind of a
thanks,
bridge.
Christina. I just,
Absolutely.
in hearing her, also, I want to mention one other thing. Healthcare is kind of everywhere. And so there's a lot of opportunities which we can arrange for interning, for getting work experience, short-term or long-term, paid and unpaid. So there's also lots of interning opportunities pretty much everywhere.
Yeah, Christina, I just one last question. Is there any advice that you could share, or you would, give to other students who are right now considering USC, this program, things that maybe, any advice you could give?
Yeah, absolutely. So prior to choosing USC, I had some other schools that I was considering, and looking at them and looking at their programs that were very similar or comparable to this program. Not many of them gave the experience, the kind of practicum based experience of being able to be in a hospital setting or work with people. So I think that's a huge thing to take in consideration, as well as you guys heard the statistics before, but we're a great engineering school as well. So to take that into consideration. Also, I think just USC in general, the Alumni Network is great. And a lot of people have reached out. And I think that USC has provided a lot of opportunities. And it's just what you make of it. So I think here, better than any other place, there's a lot of opportunities. Again, being in the hospital, there's just been a lot of avenues that you can explore, whether it be healthcare, whether it not be healthcare. So I think that experience has been great, and that's some advice to give to you guys in considering. This is one of those schools that definitely they want to bring their students back and have loyalty to their programs and loyalty to their alumni as well. So they try to partner you and pair you with people that are going to further your career. So definitely would look at that compared to other schools that you may be looking at as well.
Thank you so much. Yeah, they call it the Trojan Family. So it's, once you're a Trojan, you're always a Trojan. Christina, I thank you for your time this afternoon and coming to share your experience. It's very valuable and really nice to hear. So thank you so much. We'll move on now. Just want to go over just kind of our general masters. I'm not sure where those of you in the audience kind of are in terms of your academic career. So this is just kind of general background. As we mentioned kind of earlier, our master's programs are very popular. Generally, it takes a student full-time on campus 1.5 to 2 years to complete their degree. This program in health systems management is 31 units, which will translate into, is that about eight courses, Dr. Belson?
Yeah, yes.
Okay, yeah. And I think it's really important to remember that just from the experience that Dr. Belson provided and Christina, this program is not just theoretical, you're actually applying it as well. So you have some applied experience, which is really exciting.
Also, Bill, we should mention that all the courses are available online. So you don't necessarily have to be in Los Angeles. Not a bad place to be, but you can also take courses online.
Yeah, that's an important thing that I'll go to our DEN slide actually in a minute. This background information is more kind of a general. This program does allow some flexibility in terms of background. So even if it's not a Bachelor of Science, if you have a BA, it depends on the courses that you've taken, potentially in biology or things of that nature, economics, even potentially. So there is some flexibility in background. I do want to say though, if you are thinking of applying for fall 2022, we have extended the deadline. So right now it's March 1st for this program. We potentially probably will extend it to April 1st as well. But I do want to offer those of you who have joined an application fee waiver. If you are considering applying to this program, we can waive your application fee for this program. So do contact myself, and I'll leave my contact information in the chat right now, so that if you are interested, I'm happy to provide for this program a fee waiver for fall 2022. Which would begin kind of mid-August. Okay, so just going over really briefly in terms of cost, this is a 31 unit program, and I broke out the costs there. This is roughly total cost. Don't be scared, because I'm going to talk about scholarships on the next slide. So the total cost for this program is a little over $68,000. That's based on the current year tuition. Keep in mind that the university does typically hike tuition 1 to 2% every year. But I put this there just to give you a rough estimate of total cost. Now, in terms of scholarships, the engineering school does have a number of scholarships. There's a Dean's Master, and it depends on when you apply. There's a Dean's Master's and endowed scholarships. There's also Den of Viterbi is our online program, which I'll talk about in the next slide. But we do have a unique special scholarship, our Health Systems Management Scholarship. It is a donor-funded scholarship that is available for students who apply for fall. David, I don't know if you want to chime in with any additional information about these scholarships, but they're well funded for sure.
No, just no, you pretty well explained it. There's scholarships available of various sorts. That's part of the application, basically, I guess.
Yeah. Okay, so our distance program is called Den of Viterbi, and it's an acronym that we've had for years. It stands for Distance Education Network. Essentially, it's our online delivery method. It's the on-campus lecture. We're really fortunate here at the Viterbi School to have been doing online engineering programs pre-pandemic for 20 years, pre-pandemic even. We've been doing it for years. And it's essentially the delivery method. How it works is it's our on-campus lectures streamed over the internet live as they're happening online. Now, we have a lot of students who are unable to watch live. That's fine. The lectures are recorded and posted and archived onto a server for the rest of the semester for our online students to watch, download. Even our on-campus students, they have access to the recordings as well. So it does become a really valuable study tool for a student to be able to go back and watch kind of a recording of the lecture. Our distance program, as I mentioned previously, is very highly ranked. It's kind of a well-oiled machine at this point. Been doing a lot of online for a while, so we know what works, what doesn't work. So I'll just say that, and this program is definitely available online as well. Okay, we do have on our website some facts and figures that we're actually currently in the process of updating. This is a couple years old, but look for that on some of our degree program pages about information about our departments. Coming to the conclusion now, so if you do have any questions, please feel free to reach out. One of the questions that we often receive, if whether or not TA or RAs are available for master's students, those are generally reserved for PhD students. So it is very rare for a master's student to receive a TA or RA-ship, so just know that. What impact does work experience have on an application? It's not actually an application criterion. We do require a resume or CV to be uploaded as part of the application. It's just we share the application system with other schools at the university, so it is one of the requirements. What should I write in a personal statement? Personal statement is your opportunity to really paint a picture about you as a student outside of just our admissions office looking at, you know, numbers in a transfer. So it's really the qualitative part of your application. You could describe your reasons for applying, your interest in the program, any career plan, how this program can help you in future career goals. So it is very open for what you can write in a personal statement. So some next steps here. These are just direct links to programs that, and pages that we have. I'll go ahead and send these slides to those of you who joined, and I'll send a recording as well once we have it uploaded, so you can have access to them. But that's pretty much it for the audio portion of our webinar in terms of my part and Dr. Belson's. But now it's your turn. If you do have questions, please do feel free to ask the question. We have a question that came in. Are you able to complete this during a time frame longer than the 2 years, considering taking courses online while also working? Yes, that's actually a wonderful point that I did not mention, so I apologize. Our online students typically do take longer than 2 years. On average, they're looking at maybe 3.5 to 4 years. A lot of them only take one class a semester, so that's entirely okay.
One thing I do want to mention for anyone that does want to be an online student and do the program on a part-time basis is that the program does still need to be completed within 5 years.
Yeah, that's a good point. Thank you. That was Ray, one of my colleagues, the voice of Ray Fujioka. Thanks for joining. Okay, well, I'll give another minute or so for any questions.
I posted my email in the chat if anybody wants to ask me anything.
Yeah, please do feel free to email us. Dr. Belson and I both posted our emails, our direct emails in the chat. So please don't hesitate to contact either of us with any questions. Dr. Belson really is best for, you know, if you have questions specific about the program. I'm on more general questions maybe, but we both can help. But yeah, he knows all the projects, all the classes, like the back of his hand. So just want to clarify that distinction. Yeah, okay, well, I guess that about does it. I will, like I mentioned, I did record this webinar, so I'll be happy to share that with you. Give me about a day or two to get it uploaded, and as well as the slides. But I do want to thank those of you who have taken the time out of your schedule to join us today. We hope that you gained a lot more information about our Master of Science in Health Systems Management Engineering program. And just know that we're here to help you along the way and to answer any questions that you may have about the program. Thank you so much. That pretty much does it for the webinar. So yeah, we hope to hear from you soon. Thank you. Bye-bye.